And hello and welcome to our panel. Mental health champion counsellors, and especially to Eve, who is a mental health champion and is joining us representing Kingston Council, and to also Councillor Chris Stewart, our mental health champion for the disabled, and Chris will be joining us shortly. We're absolutely delighted to be here this morning. This session is being recorded and will be available to view or download at the start of Mental Health Week, which is week commencing the 18th of May. We have an exciting session lined up, and residents have sent in their questions, and there'll be an opportunity for each panellist to contribute if they wish, depending on their area of expertise. At the end of the session, my colleague Mark Bainan will be delighted to sum up this morning's discussion, and we'll aim to finish this recording at 11:30. So I just wanted to kick off by saying my name's Anita Sharper, and I'm a local councillor in Berrylands Ward, and I'm a mental health champion for children's and adults care and education. I have great pleasure in introducing my colleagues in turn. So if you'd like to start off, Mark, thanks.
Thanks, Anita. Yes, I'm Mark Bainan, also a councillor for Alexandra Ward, and I'm a mental health champion on the Finance and Partnerships Committee. Thank you. And
Leslie?
Thank you, Mark. I'm Councillor Leslie Heap. I'm also a local councillor in Kingston in Beverley Ward, which is Malden, and I'm mental health champion for strategic housing and planning.
And Chris is joining us shortly. So if I move over to Eve, thank you. Oh, Chris, you're here. Good morning, Chris. If you could just introduce yourself, Chris.
I'm Councillor Christine Stewart. I'm a councillor for Chessington South, and I'm overall disability champion for the borough. Thanks, Chris. And over to you, Eve.
Thanks, Anita. Hi, I'm Eve. I'm an employee mental wellbeing champion at Kingston Council. So the champion's there really to encourage good mental health in the workplace, make sure it's a priority, and just be a friendly face for colleagues to speak to if they need.
Thank you, Eve. And I'd now like to turn to our panel, Helen Daly, Annette Brown, Katie Harrison and Danny O'Connell. Welcome. I'm delighted to introduce them, and they will each say a few words of introduction so everybody knows who they are and what they do. So if I could just perhaps turn to you first, Helen, if you wouldn't mind. Thank you.
Yeah, hi, I'm Helen Daly. I'm an evaluation lead at Thrive London, and Thrive is a mental health social movement across the City of London. We're supported by the Mayor, but we sit within the NHS, and our aim is to give every Londoner the best opportunity to good mental health and wellbeing.
Thank you, Helen, and over to you, Annette.
Oh, I'm Annette Brown. I'm Manager of Community Learning for Kingston Adult Education, and one of our main focus areas at the moment is the delivering online mental wellbeing courses, as well as many other things, but mostly mental wellbeing at the moment.
Thank you very much, Annette. Over to you, Katie.
Hi, thank you. I'm Katie Harrison. I'm Principal Policy and Projects Officer at London Councils. So London Councils is a collective organisation of all of the London boroughs, and we lead on policy issues. I personally lead on issues to do with children and young people and mental health.
Thank you so much, Katie. And over to you, Danny.
Thank you so much for having me. My name's Danny O'Connell. I'm the project coordinator for a service called People Can, and we come from an organisation called Community Catalyst, which is all about people with mental health, autism and learning disabilities setting up their own groups, activities and businesses. And it's brilliant to be here.
Thank you so much to you all. I think I'd just very briefly like to say that as mental health champions, we feel passionate about mental health, as we all do. And in our capacity as counsellors, we often find ourselves wanting to understand more about the issues that are affecting our residents and how we can help and support them. And we often find ourselves in the front line dealing with vulnerable residents, and they come to us because they're in need of advice and support. And it isn't always easy, as we know. And so often we turn to the experts in the field like yourselves and to the community that we can turn to when we need help and advice, or when urgent action or intervention is required. So we're absolutely delighted that you're here with us today. And I think what I'd like to do now is turn to the questions which residents have kindly sent in. There are 8 questions in total, and we'll be asking the panels to respond to each question in turn, and I think I'm going to go straight into the first question. So if Annette, if you could answer this following question in turn, all panelists can if you like. The question is, how will mental health services be able to offer support to those already in the system and those not in the system once the worst of the crisis is over? And obviously we've assumed the residents is talking about mental health issues and challenges. So if you could start us off, Annette, that'd be fantastic.
Okay. So how big the demand will, obviously, it's unknown really, but we are anticipating that there is going to be a great demand. We at KAE have been running a number of mental wellbeing courses over the years, and they are supported by the mental health services. Anybody can access these courses, and from anything from stress and anxiety management to improving sleep, resilient skills, but we're looking at some courses at the moment for coping with life after lockdown, and preparing for life after lockdown, because it's going to have a massive effect on so many. So we are very active, and as I say, anybody can actually contact us to arrange to enrol on one of those courses.
Thank you so much, Annette. Perhaps Katie, if you could add to that. Thank you.
Yeah, absolutely. I think Annette's right. The level of demand is just unclear at the moment, but we are anticipating that it's going to increase. And I think that's going to be a challenge that both community services, mental health services and charities are all going to be kind of focusing on over the coming months. And I think it's going to be particularly important to think about how we can take advantage of the innovations that we developed during the lockdown phase and take those forward into recovery.
Thank you very much, Katie. I think that's very important. And then over to you, Danny.
Well, I think it's a very interesting time to be running a service, and actually we are living in a borough that's quite good with what they can offer around mental health, and local charities are giving away a lot of stuff to people. And what this whole process has taught us is to think outside the box, which essentially is what we're doing every single day, which I think is a fantastic thing, actually. If there's one silver lining out of all of this, is how to reach people and how to meet the need. And so, for example, Kingston Mind are running virtual groups every single day, activities they can do. People who don't have internet access and have mental health diagnosis are contacting me via telephone to sort of get their groups and activities running. So it's about adapting to the situation and trying to make the best of it. And actually working on a group or activity at this time based on a hobby has really empowered people to think outside the situation and give them some kind of levity, because it can be quite heavy at times. And yeah, it's been an interesting time, but it's made us think outside the box, which is so important. And I think we always needed to do, really.
Thank you so much, Danny, for that. That's all of you that have commented on the first question. I think that's very, very interesting. Lots of ideas and innovation. I think it's the key. I think one of the things one of the themes that's coming out today is about we need to be innovative and flexible about how we approach this whole situation moving forward, and how we, when the lockdown is eased, how do we manage ourselves and our mental health ongoing? And I think the amount of support in the network out there, it's so important to get those messages out. So thank you very much indeed. So moving on to the next question. Question 2 is from the resident is, do you think that teachers will need support to change the focus of lessons when pupils finally go back to school? And the resident just further wants to mention we are rightly focused on academic activities at the moment, but so many children will need mental health and wellbeing support when they return to school. Maybe a focus on resilience, mindfulness and wellbeing for a few weeks or months, rather than pressure on teachers and the kids to go full steam ahead with the normal curriculum. So interesting questions. So if I could start off, Helen, if you would like to go first. Many thanks.
Yeah. So I think that teachers play such an important role in children's development in terms of their education, but also with their psychological and social development from such a young age. So it's really important that teachers and all school staff's needs are prioritised to firstly look after themselves. So we've seen massive transition over the last couple of weeks and months, moving school platforms online or remotely. It's been a really stressful and just strange time for teachers and all school staff in adapting how they work. So it's essential that their needs are supported now and as the return to school continues on, because I'm sure it's going to be quite a stressful and unusual time for them. So they really need to be supported to manage the stress and cope with the transition back to school. And secondly, yes, they do need to be upskilled and supported to continue to work with children and families who've been affected by COVID in like so many different ways. So I know it's likely there's going to be such a wide range of implications, and that's going to be really acutely felt in classrooms and in schools. But we do know that there's huge appetite within the schooling and education system already. So previously, Thrive London had trained over 2,000 teachers and school staff in mental health first aid. So this is work is set to continue across London and within Kingston to upskill and support teachers to best support children, to best role model things around psychological and social support, and to really open up the conversation around mental health and well-being with children from a very young age.
Thank you so much, Helen, for that. That's very interesting. I think I'm sensing that there's a key element here of support and upskilling, really. So again, this idea of being flexible and adaptive to what's happening around us. Thank you very much, Helen. Over to you, Annette. Thank you.
Thank you. Well, the good news is that schools have been really proactive over the last couple of years in training their teachers, getting mental health support in for parents, and to pass on to children. But also, it's very important for the teachers to be looking after their own mental health, because if they're not good, then the kids aren't going to be. So we've already been doing this, working with them, and they know. We have offered to go into all schools if they want to go through courses like resilience training, mindfulness, stress and anxiety, and all of those skills. And as I say, that will be available to teachers and parents as well. Probably separately, because teachers need their own safe space. So we are working on that, and as I say, we're in touch with schools at the moment about that. So it will just, we will move on. They will most definitely be focusing on that. That's the only way that children can learn or teachers can perform, if they're looking after their own mental health.
Thank you so much, Annette. I think absolutely. I think there's probably an expectation in a way that we're going through a period of change, and change is upon us, and I think it just becomes this more and more essential for us as both parents and teachers and those in the wider community and experts in the field, that we all really are there to support and listen. I think is going to be very important, listening to parents, listening to children and what their needs are during these unprecedented times. So thank you very much, Annette. Over to you, Katie.
Thank you. Yeah, I would just like to reflect on how kind of gratifying it is to hear from my fellow panelists about the existing expertise and support around schools at this time. And I think it's true that there's a very good system of support for schools to help teachers through this difficult time, and also, especially in London, kind of building on things that schools have learned in the wake of terrorist disasters and situations like Grenfell. I think we've got really good expertise in these areas. But I think at the current moment, it's important that we build on that with kind of additional COVID-related concerns. So thinking about how we can address health anxieties of the students who are coming back to school, as well as the teachers, and thinking about the disproportionality aspects and how we can provide support for BME students who may have additional concerns, and also obviously the bereavement support that's going to be essential when people's come back.
Thank you, Katie. I think that's so important. Each individual it's a unique case, isn't it? There's not a one size fits all. Each pupil, each person will have their own personal experience of COVID. And I think actually the feedback and the stories that we can tell are going to be so important. and that we share our experiences. Thank you, Katie. Danny, over to you.
Sure, and the thing that comes through, and it's exactly as most people have said already, is the need for personalisation. This has never been done before. I think Brene Brown said that in her recent podcast. I was listening yesterday, actually. She said, this has never happened before. So there's a sense of needing to be vulnerable and needing to accept help and support where you can, and personalising and tailoring to each individual's needs. Now, I know that's going to be more costly in time, but as Katie just said, the amount of bereavement support that's going to need to happen, the amount of trauma work that might need to happen, it's about really readjusting to the individual rather than the overview of people. It's about tailoring to each individual, and that goes for teachers, parents, and children, because, you know, not just saying we've forgotten that most parents have been schooling their children for the last 2 months, so that's going to be a huge amount of strain and pressure and worry as well about how their child's going to adapt once they go back into schooling education. But yeah, this has never happened before. So we're going to have to reflect the times and think on our feet about how to support people as best as we can.
Thank you so much, Danny. I think that's very, very important, this idea of that it's never happened before, and, you know, accepting that vulnerability, I think, and just being, you know, that greater awareness that we have about our own personal experiences and the anxiety that we all may have felt during COVID and beyond, I think. So thank you, Danny, for that. So moving on to the next question. It's in 2 parts, but perhaps we can try and bring them together in terms of ease to be able to answer them. I think the question from the resident is, should teams be offering virtual appointments? Video seems to be the most sensible, and as soon as possible to those who've been waiting to be seen since the lockdown. This would include CAMS appointments, for example, and how can clinicians be supported to work in this new way? So I think if I can start off with you, Annette, on this one. Thank you very much.
My understanding is that practitioners have started using a platform called, I think it's called Attend Anywhere, which, whilst it's not as good as face-to-face appointments, the feedback has been that it's been well received, and I suppose it is a good compromise now. So that's as far as I know, but as I say, it is being actively rolled out across Richmond and Kingston.
Thank you, Annette. Over to you, Katie.
Yes, I agree with Annette. I mean, I'm aware of, I think, many practitioners who are now moving to online platforms. I think there's a lesson that can be learned from primary care services who have perhaps more of a history of interacting with their patients over the phone or using digital means. So I think it's about learning from those experiences and making sure that clinicians are happy using them.
Yeah, thank you, Casey. I think there's a theme of partnership working here as well. I think we're all trying to work with these issues together, and how we join ourselves up and communicate is so important. I think, thank you, Casey. I think, Danny, over to you. Thank you.
I think I have a lot of respect, and also I'm lucky enough to be friends and come from a family of NHS frontline workers. And in my experience talking to them and being a previous frontline worker myself, I think it's about really looking after our staff and making sure they're given the right provisions and the right sort of security in order to create that consistent relationship, because within mental health services, there is a need for consistency. And it's about making sure everyone can live up to that and sort of help people as best they can. And so if someone is not, one of the big thing is not everyone has internet access. So it's thinking about that, thinking about how to create a relationship with someone who's going through crisis, and ensuring that people aren't alone during this time. It's all very well and good. We have our daily walks or going to the shops, but not everyone has that opportunity. So it's about realizing that and sort of working with that individual to make a plan, a care plan for them that works for them.
Thank you, Danny. That is so important. So if I can move on to question 4, what can those without outdoor space and unable to go outside, if they're shielding and vulnerable, do to protect their mental health? If I could start off with you, Helen, that would be great. Thank you.
Yeah, sure. Well, I think this is such a relevant issue to London and Londoners, since many of us do not have access to gardens or private space outside. And also there's just such a huge number of people who are clinically vulnerable or shielding as a result of lockdown. And I guess to face facts, unfortunately, the risk of poor mental health is increasing, and we cannot rely on our usual coping mechanisms and strategies that we often put in place, like spending time with family, socialising, physically socialising with people, or just going out at a walk at a time that suits you. But there are many things that we can do, simple things to support our mental health and well-being, and simply as being kind to yourself, taking time to try and stay calm and admit that and understand that it's actually okay to not be okay. But what we can do is reach out and try and be as open and talk to someone that we trust about the problems that we are experiencing, because for the first time, absolutely everybody is going through a similar scenario, and we can really be open and talk about how those feelings are affecting us. And I guess there is a lot of support available online at the moment, but it's important to acknowledge that not everyone has access to the internet or is digitally enabled. So it's about spreading those messages around good mental health to those who don't have access online. So at Thrive London, what we've done is started producing some collateral for people who are not digitally enabled. So we're working through local authorities. 3,000 Z cards have been delivered to Kingston, or being delivered this week, and they're going out through the volunteering hubs to local residents who might be receiving urgent supplies or connected with the local authority. So they're just simple messages around being kind to yourself, taking time, and pausing and reflecting on what we're going through.
Thank you, Helen. We've got about 5 minutes left of our session. It's sort of whizzed through. So if I could go to you all, Annette, Katie and Danny in turn. So if I go to you first, Annette, and then I'm going to combine a couple of questions I think would be easier for us. Thank you so much. Over to you, Annette.
One of the things that I was thinking about was maybe going through old photos and maybe sticking them in a scrapbook and writing about what happened, because I've got thousands of photos, and for my mum, and I think, who was that? What was that? So it might be something, a nice reminiscent thing for people maybe suffering with dementia or whatever, so that it's just a lovely activity to do. It's just a thought there, throwing it out.
Thank you, Annette. That's very good, very interesting. Thank you. Over to you, Katie.
Yeah, I'd agree with both Annette and Helen. I think it's the simple things that you can do that really make the difference. And I think when it's boredom and frustration are such big issues when you're just stuck at home all day, every day. So I think it's just remembering kind of the simple activities that you really enjoy and making sure you always keep time to do them.
Thank you, Katie. And over to you, Danny.
I'm a huge advocate for meditation. So just having 5 minutes to yourself where no one's at you and you can just lose yourself. The guided meditation really works for me. In terms of working with clients and people who have diagnosis and disability and all between, it's about setting a routine and not dealing with it on your own, and realizing this is a very human experience. It's okay to have bad days. And there's always a, Samaritan Saint line, there's always someone who's willing to listen and just hear you talk. Because I think the worst part of this is because we're cooped inside and because we're not out connecting with people, we really lack that sense of connection. So it's just getting it where you can. And I'm a huge advocate for podcasts as well, and arts and crafts, even though I'm not very good. But just little bits and bobs like that just really make you go and lift you up a bit, because you've done something. You've got the end product there in front of you. And connecting with people you really care about is really key as well.
Thank you, Danny, so much. So I think we may have to whiz through the next two questions. So I'm going to sort of slightly combine it. I'm going to, the question is, how can our workplaces support employees in gradually returning to the workplace? And also, if you have, what advice you can give to support a friend if they're struggling? I think mental health broaching the topic of mental health is always difficult, but I think they're the two areas. It's returning, what do you think workplaces can do to support employees returning to the workplace? And if we are worried about a friend, how can we support them? What advice can we give? If I could start with you, Helen, that'd be great. Thank you.
Yeah, sure. So just on employers, I think on a very practical level, it's important to share clear information on what a safe return to work looks like for an organisation and also for employees, and with the aim to reduce the risk of rumours and inducing any unnecessary fear for employees, because these are just such uncertain times. And also, where possible, it's really important for employers to engage with their staff and understand what their needs are. And I understand that workplaces look so different for so many different people, and employees are so different. So it's important to understand, reach out and ask people how they're feeling and how the employers can best support them on the return to work. And I guess the thing, very quickly, on supporting a friend who may be struggling, I think listening is just such an important skill that we all have and can make such just a massive difference. So sometimes we can feel a lot of pressure when someone does talk to us about they're struggling, but it's actually a really good thing that someone is being open and honest with you and is trusting you. So we may not have all the answers, and that's okay, but sometimes it's just okay. It's good to be able to talk openly and hear yourself, and then also just to remember that there is always help out there. So even if you do not know the answers, there's help from your GP, from calling NHS 111. There's still help available out there, or else calling a tech service like Shout or the Samaritans, which has already been mentioned.
Thank you very much, Helen, for that. Over to you, Annette.
Just to add to that, really, a bit of advice that I was given a long time ago was that if you can't change it, change the way you think about it. So I think that if you're with regards to friends or family, maybe it's a case of you talking about your own feelings to try and open up that dialogue with them, and then suggesting maybe that that you're going to do an online course or whatever, and ask them to join you, because it's almost acknowledge, the whole thing that we said earlier, it's okay not to be okay. And but sometimes people will draw barriers up. So really just doing that distraction again, sort of involving yourself in something that's distracting with your friend or colleague would be good, because we know that's a way to get through.
Thank you so much, Annette. I think that's very, very true, to talk about our feelings. I think that's and sharing experiences is so important. Over to you, Katie.
Yeah, thank you. I think a lot of the important points have already been covered, but I'd just say not to feel overwhelmed if you feel like the person you're talking to is in a crisis position. As Helen mentioned, there are really excellent crisis services out there provided by Samaritans and Shout, and you should always contact your GP as the first port of call. And don't be concerned to offer to go with your friend to the GP, just to kind of provide that support, but make sure that they're getting the help they need.
Thank you, Katie. That's so true. And over to you, Danny.
I think the first question has been answered really well already, so I wouldn't want to add to that because it's great as it is. But in terms of friends struggling, that's now become a weekly occurrence in this house, where a friend feels like they're cracking up because of the situation, the lack of work, and the best thing you can do is check in, whether that's daily. Do what you can, obviously, within times and provision, but checking in with someone really makes their day, because it makes you feel like you've been thought of and that you're valued and that you're part of the bigger community. And especially within where I live, staying in contact, obviously within 2 metre distance, with the elderly members of the residents makes them feel valued. So it's creating that sense of community, even with your friends, with your neighbours. And that's the other silver lining that's come through with this. But just check in and try and have a laugh as well, because things are so tough at the moment. It's good to open up and say, I had this thought today, it was silly, and then just talk about it.
Thank you, Dana. That's so true. I think this idea, it can be very isolating experience, and what we've all had to go through. So that's very important. Thank you, Danny, for that. And the last question is, what advice can the panel give for any residents attempting to recover from such a situation post-COVID, if they've been isolated at home, they've had issues with perhaps neighbours or antisocial behaviour or things like that? It's sort of psychologically affecting people. And again, I think we've sort of touched on this earlier about all the help mechanisms that are out there. But the last question was really, I think, just general advice for residents as they attempt to recover from this situation. I think over to you, Annette, on this one. Thank you.
I think it's good to talk. And, you know, I think maybe socially distancing yourself and having a cup of tea, whether it's in your flats and sitting on the balcony or whatever, you know, especially if you're experiencing any issues, neighbourly issues or whatever, firstly, get talking. It's very hard sometimes to do that and to break down those barriers, but little steps, even little steps, you know, leaving a cake on the doorstep or something like that. It's really important. That reconnection is so important. I've got lots to say, but I'm going to pass it on to the others because I know we're running out of time.
Thanks for that, Annette. So over to you, Katie.
Yeah, thanks, Annette. I would agree, and I think it's really important as the government and country slowly goes into the recovery phase, that we don't think, oh, we'll be back to normal, so our mental health will be back to normal. I think we need to recognise that some of these anxieties and stresses and issues are going to be with us for a while. So we need to keep checking in with ourselves and with others as recovery continues.
Thank you, Katie. I think the sense is that we might be in this for a longer term period of change, very much so. I mean, over to you, Danny, for final words on that question.
Well, I'm lucky enough to work with people who are within the system at the moment and recovering. And one of the things they could say is watch less of the news. That's been a kind of a recurring theme, you know, watch what you have to, not what you know, given, and sort of editing and choosing what conversations to have with people, putting a boundary around yourself because you're still in that process of recovery. And like Katie said, it's not going to be exactly the same straight away, and it's adapting as best you can day by day. And that's it. And you're not alone on this at all.
Thank you so much for that, Danny. I think what I'd like to do then is finally just say, could each of the panelists just perhaps say a few final words, anything inspirational that you'd like to say in summing up? I think we've had an excellent set of questions answered. So thank you so much. So if I can just go to you, Helen, have you got any final words that you'd like to say?
Yeah, I think it's really important that we use the power of communities and individuals in engaging with each other. At this time, we've seen massive amounts of people coming together to help their communities and those most vulnerable, like with mutual aid and other things. So there's a real opportunity to continue this on into what the new world will look like.
Thank you so much, Helen. Over to you, Annette.
One of the things I was going to say is that it's quite important really to get talking, even if it's joining a support group or class, because what you'll find is that, you know, something that you've been feeling that you think you're isolated on is probably something else that someone else is feeling, and it will normalize the situation, because at the moment the norm is that we're not in a normal situation, if it makes sense. So talking about things, sharing experiences, because it might be that you're able to solve each other's problems. You know, this isn't going to go away anytime soon, but just helping each other, knowing that other people are going through the same thing, I think can be really healing and powerful.
Thank you so much. Thank you so much for that, Annette. Over to you, Katie.
Yeah, I think I would just say a top tip for anyone working from home is just to make sure you always have a daily contact with at least somebody in your team, just to kind of have a chat or see a friendly face, which I've personally found really, really supportive during home working.
Thank you so much, Katie, for that. And over to you, Danny. Final words.
I would say schedule in some fun. And what I mean by that is put something in the diary with a Zoom party, albeit if it goes wrong in the process of doing it, but also always make sure you're doing something positive at the end of the week, because the weeks are longer and there is more time at home. So it's about just putting that little bit of fun in your life, whether it be an activity or a virtual online Zumba class or anything like that, which we have loads of services within Kingston that offer that. But it's about just having some kind of positivity. That's my final thought.
Thank you so much, everybody. I think I'm just going to ask the mental health champions who have been listening in whether they'd like to say any final words. So if you could all unmute, that would be fantastic. So Mark, over to you. Oh, sorry, I do apologise. Leslie, over to you first, and then Mark, I think you'd like to sum up at the end. So over to you, Leslie, if there's anything you'd like to add, just a few final words.
Yeah, I'd like to thank the panel. It's been great, very informative, the answers to all the questions. I think we're all feeling the strain in some way or other, and it's been really good listening to their expertise today. Thank you.
Thank you so much, Leslie. And over to you, Chris. Have you got any comments or final words you'd like to say?
I think everybody has been finding lockdown a struggle, but I've got a feeling post-lockdown is going to be possibly a bigger struggle. So let's look forward to the challenge and see what we can do.
Thank you so much, Chris. And over to you, Eve.
Thanks, Anita. Yeah, thank you so much, everyone. Honestly, that was really interesting, useful. One thing I would say is, as we go back to, or we try to go back to normality, just be patient with ourselves, no rush. As you all said, use the support networks that we have out there, and really keep using them as we do go back to normality, because we've been using digital networks so much more now, and actually we can keep doing that. So yeah, thank you.
Thank you, Eve. I mean, I agree. I think managing expectations is a good step sometimes to managing our daily stresses and not being so hard on ourselves. And we don't have to be perfectionists all the time. We're in strange times at the moment. So, but I just want to say thank you again to all the panelists. And I think, Mark, you wanted to do a little bit of summing up, didn't you? So over to you, Mark. Thank you so much.
Thanks, Anita, and yeah, obviously, thank you very much for all your contributions. I mean, people are finding it particularly stressful and a scary time, but I like to kind of highlight the positives. So, from what I've heard, I mean, this period has forced encourage people to innovate, to come up with different ways of working together. Obviously, what we're doing right now is we wouldn't have done this thought doing this, a couple of months ago. So we are, as Danny said, we're thinking out the box. I think it's shone a light on people's mental health. I mean, it's an area that it has been receiving more and more publicity over the last few years, but this will help accelerate that, I think. People who've never really thought about their mental health very much in the past will now find themselves in this unique situation, and it's something that, we all have more time to think, and, this can be a good but sometimes a bad thing if you're thinking too much, but it means people are forced to think about their mental health and to come up with creative ways to, spend their time. So I think people will be trying different things, maybe the mindfulness and the like. And I think that can be a positive. So I think, yeah, we'll see how we go in the future, but hopefully this will be integrating mental health kind of conversations, mindfulness and the like more and more in schools. So hopefully this provides people with more of an opportunity to find out more about mental health, of their own mental health, about others. And I think it can hopefully be a positive experience, despite obviously, I mean, it's a terrible situation in many ways, but we can looking at the positives and, what can we do to, make the most of this situation. So I think that it can be a positive experience. As far as mental health goes, one thing I'd like to point out is just looking at the screen in front of me, I am the only guy on this conversation, and don't get me wrong, I think it's great to have so many women, and but guys, we know that guys, unfortunately, they're if you look at suicides, they're guys. It's the time it kills in terms of, I think I can't remember the exact figures, but young men, it is one of the highest. The main cause of death is suicide. So, guys, we need yes. So sometimes I don't like to stick to stereotypes, but guys, we need to talk a bit more and be more open. So, I think, I'd like to put that message out there. So hopefully, there's more guys listening to this than participating in this conversation. So, we need to, we've got an opportunity now to talk, and it's to man up and really kind of be open and honest with our feelings. So, I think that's something that's important. And something we need to work on. Finally, I think there should be. Hopefully, we've managed to send out a link with this conversation to Kingston Council's community hub. So If you fill out the form, if you follow the link, hopefully you'll be taken to a form which you can fill in. So not just mental health, but obviously mental health issues. If you're having any other issues, Kingston Council, we've got a community hub which is there to help people in need. If they can't help directly, then they've been dealing with lots and lots of people in the community already. They can hopefully signpost you to the right organisation who can help you. So please do take advantage of that. It's there for you to just to help you in this time. And finally, thank you, Danny, Katie, Helen and Annette for taking your time out to contribute to this session. I found it really useful, really informative. I mean, we could have gone on for another couple of hours, but I might have tested people's patience even to the limit in this time. It might not help their mental health, but I think it's been really useful. So really appreciate your time. Hopefully people listening have found it useful and informative. If you have any feedback, I don't know if we're going to send out, I've just come up with the idea, send out a feedback link with this. I don't know, Eve, if I put that on you, somewhere we can give us feedback. Or you might want to kind of cut this bit out if you don't want to do that.
Thanks, Eve. Thank you so much, Mark. That's excellent.
Thank you.
Anyway, sorry, I think Anita's worried about time, so I'll shut up now.
But thank you so much, Mark. Thank you, everyone, for participating. Stay safe, everybody. Keep well. And let's look after our mental health. And Mental Health Week again starts week commencing the 18th of May. Thank you all very much indeed as I wrap up the session. Thank you all.
Thank you.